Good day to you all. My name is Nr Shazali Yau Mani, and today's presentation is going to be on the topic what is nursing. Now, nursing got so many definitions, so many scholars, so many organizations trying to define nursing in different patterns. The first one to look at here says nursing is a profession that integrates science, art, and compassion. These three things are there. Science is there in nursing, art is there in nursing, and compassion. And the essence is now to promote, protect, and restore health. Then American Nurses Association, ANA, in 2021 says that nursing is the diagnosis and treatment of human response and advocacy in the care of individuals, families, groups, communities, and population in recognition of the connections of all humanity. By this definition, it means that nursing is the art of or the act of diagnosing and treating human responses to a disease process, human responses to the changes in the environment, human responses to changes in the human or factors that affect the human life. And this one can be for an individual, families, groups, or communities, and the entire population. Another definition by International Council of Nurses in 2002 is that nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups, and communities, sick or well and in all settings, meaning that nursing encompasses or roundabout autonomous, providing autonomous care with the nurse himself will initiate, will plan, will implement, will evaluate the care on the patient. Or it can be a collaborative care where a nurse needs to collaborate with other health professionals in the healthcare field. And the essence is to provide care to individuals, persons in particular. These individuals can be of all ages, regardless of whether they are pediatric, that is young children, it may be young adults, it may be adults, it may be old ages. And families as well. It can be a care given to an entire family, a group. This group can be of any kind of group of businessmen, group of student, group of health professional, groups of whichever kind, sick or well, and in all settings, meaning that nursing do take care of people who are sick and people who are well, and in all settings, any setting you can think of, not necessarily in the hospital. Nursing includes the promotion of health, which is very important for somebody who is living. You need to promote health. So nursing has to do with promotion of health. When health is promoted, then illness should be prevented. That is prevention of illness. All measures to be taken or all measures taken to prevent illness are part of the responsibilities of nurses. And also the care of the ill. Those people who are already ill, nursing deal with care of the ill persons. At the same time, the disabled one, and even those that are dying, meaning that nursing is not only focusing on the sick, it's not only focusing on the people who are ill, it's not only provided in the hospital, whether you are sick or you are well, whether you are disabled or you are able, even if the person is at the point of death, nursing is the act of taking care of such a person. Nursing as a profession also deals with advocacy for issues that has to do with the health of the public, promotion of safe environment, or conducting research, because profession cannot develop or cannot be existing without research. Participation in shaping health policy and inpatient and health system management and education are also key nursing roles. This is the definition by the International Council of Nurses, ICN 2002. The American Nurses Association also gave another definition by saying that nursing, they define nursing as a protection, promotion. They define nursing as the protection, promotion, and optimization of health and abilities, prevention of illness and injuries, alleviation of suffering through diagnosis and treatment of human responses, and advocacy in the care of individuals, families, communities, and population. Henderson's definition of nursing, that is the definition by Virginia Henderson, she defined nursing as the unique function of a nurse. That is, she said that the unique function of the nurse is to assist the individual, assistance of individual. This individual may be sick or well. How do we assist them, or how do nurses assist them? In the performance of those activities contributing to health, or those activities contributing to recovery of health, or those activities leading to peaceful death, that the person, that is the individual or the patient, will perform unaided if he had the necessary strength or will or knowledge. But if the person is not having necessary strength, or the person is not having the necessary will, or if the person is not having the necessary knowledge, or if the person cannot carry it out, then it is the function of the nurse to assist that individual in doing such activities. And to do this, it has to be in such a way as to help him, that is the individual or the patient, in gaining independence as rapidly as possible. Major important or very important thing that nurses do is to assist an individual to recover optimal health, so that something that the one a patient cannot do, he can now gain independence to do it himself. Core objectives of nursing include promote health and wellness. Nurses do promote health and wellness. Prevent illness and injuries. Alleviate suffering through diagnosis and treatment, as well as advocate for patients' needs and rights. There are, however, essential skills that nurses do possess. This include clinical expertise, ability to show expertise in clinical judgment, clinical practice, clinical procedures, and everything that has to do with treatment of ill patient in the hospital or outside the hospitals. Critical thinking, the ability to think at a time, think positively, think creatively, also in an attempt to solve the problem of a patient during emergency or during a time where critical decision making is needed. Effective communication is very important key skill in nursing. Likewise, empathy, feeling the feeling of the patient, having the feeling of the patient, putting yourself or your mind as assuming the position that the patient is, so that you can be able to render effective care with compassion and with sympathy and empathy. Leadership is another thing that nurses do have. Likewise, teamwork, adaptability and resilience. Because of the nature of the working environment, nurses need to be adaptive and resilient. Nursing, we said, is the art and science of care. So now the art and science that we have in nursing is referred to as an art, because it needs compassion, empathy, and understanding of patients' unique needs. In the aspect of science, because it is evidence-based. Whatever someone do as a nurse, there must be evidence for it. That is to say, there must be scientific rationale for what a nurse do to a patient. Medical knowledge and use of terminology. Use of technology. Then challenges that nurses usually do face worldwide. One of which is high workload and stress. Our hospitals are congested almost always, but the nurses are always in short of what is required. Worldwide, emotional demands of caring for patients. You have multiple patients to take care of, and these patients are dependent on the nurse, and therefore the nurse has to do a lot, or has to undergo a lot of emotional stress and demands. There is a need also for continuous learning, because if you do not continue to learn and update your knowledge, one can easily become outdated, and nurse can never or should not be an outdated healthcare professional. Why do nurses choose to become nurses? Because it is a rewarding and fulfilling career. There is opportunities for growth and specialization, and it is a chance to make a difference, to make a real difference in people's life. So despite the challenges, nurses choose to become nurses. In conclusion, nursing is more than a profession. It is a calling to serve humanity. Nurses are the backbone of healthcare, blending skills, compassion, and dedication in executing their role as nurses. This is a short presentation on what is nursing. If you have anything to add, you are welcome. Please, let's meet in the comment section. Thank you very much for following us and for subscribing to our YouTube channel.